A presentation by the Community Provider Association. If they want to come forward, introduce yourself. I know you all have, we've received several handouts, so just let us know which handout you're going to discuss and begin whenever you all get situated. Looks like we have a Jacqueline Blaney, Holly Johnson, and Tori Roca. If you all begin whatever order that you see fit. Oh, and obviously Carolyn. Did you fill one of these out?
I did.
You need to. I mean, not now. Just you will be in a second.
Carolyn's going to start.
Okay.
Yes,
Good morning, Mr. Chairman, committee members. I'm Caroline Meehan. I am the Executive Director of the Community Provider Association. We are Louisiana's statewide advocacy association for disability service organizations. So I actually didn't give you a handout, but I think these ladies did. So I just want to thank, and just to go back, disability service organizations, when I say that, I'm talking about providers of home and community-based services. So these are Medicaid-funded home and community-based services for people with disabilities, both developmental disabilities and aging-related or adult-onset disabilities. Also, intermediate care facilities, or ICFs, and those are facilities, community homes, group homes, where individuals with developmental disabilities live together and receive services in the community, and also support coordination services, case management services for people who receive HCBS. So I really just want to start by thanking Chairman Henry, Vice Chairman Edmonds, and this committee for meeting on this topic, for continuing to show support for these services. I know y'all remember, I think we were on every agenda of this committee last year because the committee has just taken a great interest in funding disability services. And y'all played a major role in the successes we had in the 2022 legislative session, and that included Medicaid reimbursement rate increases for that full complement of disability services that I just described, HCBS, ICFs, and support coordination. And I speak on behalf of all the organizations in my association and across the state in saying we are truly grateful for those increases. They have allowed organizations to make critical investments in our workforce and in the direct care that we give to people with disabilities. So thank you so much. So the reason I wanted to come back before the committee today is just to kind of give you a sense of where we are with these services, because you've dedicated so much time to them, and then just let you know about some things on the horizon that we're going to need your help with at the legislature and also the Department of Health's help with. And so basically, just to give you a sense of where we are, in the 2022 legislative session, the legislature appropriated significant funds to increase reimbursement rates for home and community-based services, ICFs, and support coordination. The majority of these increases are being funded with what we would call one-time money. So that includes federal funds through the American Rescue Plan Act, or ARPA, and then just other sources of one-time funds that were found within the budget. So specifically, the increases for the aging-related adult onset waivers, that's fully being funded through the American Rescue Plan Act. For the disability, the DD waivers, the waivers within OCDD, that's being funded through the NOW Fund, which is a dedicated fund within the budget. And for the ICFs, the group homes, community homes, that is just one-time money within the department's budget. So, and again, we're incredibly grateful for those increases. We pushed for them to happen this year. We knew they were being funded with one-time money. What we're asking for now is just your help as the legislature and the department's help in making a plan so we don't fall off a cliff in 2 to 3 years when the federal funds run out and when the state general fund budget constricts, which I think we all know it will, after this period we're in. And it's particularly important that these rate increases stay in place because, as I mentioned earlier, They're largely being used to fund wage increases and benefit increases and other direct care for individuals with disabilities. And those are requirements that the Department of Health put in place and that we support to be able to pay our employees more. But I'm sure y'all can understand we can't, in 2 to 3 years, if reimbursement rates are cut, we can't cut wages and benefits for staff and expect to retain them. So we just want to work with the legislature and with LDH to develop a plan that would transition these rate increases from the various sources of one-time money to state general fund and be annualized in the budget. So the first step, of course, is just going to be making sure these stay in the budget in next year's session for FY24, and then a longer-term plan to keep these increases in place once the money becomes a little tighter. So we just need to begin working on this now so we're not caught completely flat-footed in 2025, 2026. And we've started this conversation with LDH leadership, and they're aware of this issue, and we wanted to bring it to you today. So that's kind of just the lay of the land of where we are and why I'm here today representing providers. I know there are others who would like to speak on that, but I can take questions.
One question real quick. Representative Edmonds.
Thank you, Mr. Chairman. Good morning.
Morning.
So just on the practical side, so we know the rates had increased, go back to about 2008, and now we got them up to what would have been today's rate this last session. On the practical side, have our providers received their funds as far as you know? Is there a common flow? I know there has to be some things happen after July. Are we caught up? Where are we on that?
Yes, I think by and large, the money has been received, definitely for the ICFs. There's one final payment the ICFs are waiting for this fiscal year, but they've gotten the 2 other increases that were in the budget. Same with the OCDD waivers, OAS waivers.
Yes, for the most, introduce myself. Good morning, and thank you all for your attention. As Caroline said, we're really grateful for your help and support, and the folks who, I'm sorry.
Just for the record, could you state your name?
Your name.
Your name.
I'm so congested.
No worries.
My name is Jacqueline Blaney.
There we go.
And I'm good to be here. But I just wanted to comment on the Office of Aging supports that for the most part. The money has gotten to providers. There's a part of it that the department is still kind of working on, figuring how to make sure that it's gotten out in the appropriate way.
All right.
For the most
Before you testify on anything else, I wanted to clarify one other thing, and then we can continue.
Sure. Thank you.
So we're good on the monies where they were. Now, through 2025, it looks like we're pretty stable, and then after that, then there has to be a plan in place that LDH would then recommend. So has there been any meetings so far with LDH on looking at what the propositions are going to be so that we can move forward as a legislature? I think that's where we need to be today, and what we're here today is to find out, because obviously this was a great move of our colleagues to try to make certain that our ICFs and others were fully funded, something we've been working on for 8 years, I know, and we don't want that to go backwards. So where are we in response from LDH?
So we did have a preliminary meeting with LDH leadership in October to start talking about this, with the agreement to meet again in January to talk about what will be in this year's budget request to the legislature. I think the next step in that process is putting together some kind of group that brings together the different agencies within LDH who oversee our programs and stakeholders to put, I'd say, pen to paper and look at spreadsheets with the different, amounts of money we're looking at and really have a plan. So I think we've taken the first step. I think we need to, continue to really put something concrete in place.
Good. All right. Thank you, Mr. Chairman.
Representative Wheat, is this right? Representative Wheat's got a quick question.
Thank you very much, Mr. Chairman. Listen, it seemed like I've seen something that I got from LDH about a comprehensive business plan that is being referenced. Caroline, have you seen anything from LDH as far as the preparation for that business plan concerning medical rate reimbursements? Has anything been put out from LDH?
So I have seen, so this was a component of the LDH FY22 business plan that said they would complete a comprehensive rate review for all Medicaid services and have a regular schedule of reviewing the adequacy of those rates. I've seen that they've finished that comprehensive rate review, but I haven't seen the actual schedule of the rate review.
So no anticipation as far as you know when that will be put forward?
No,
Okay.
I'm not sure.
Well, maybe that's a question we could ask LDH. Sure. Thank you.
Thank you.
Okay, thank you, sir. Are you finished with your?
I am, thank you.
Whoever would like to go next, please just
Good
introduce
morning,
yourself.
committee. Thank you for being here with us and giving us a chance to speak. My name is Holly Johnson. I also represent providers and the advocacy group. I'm also a parent of a child, so I'm various in all the stakeholder reports and things like that. One thing I would want to comment, Representative Edmond and Representative Wheat, in 2008, we actually took a 30% cut. So we have been playing catch up, in all these years. We have requested rate methodology, but the one thing that's been a big concern is all the things that have been put on the providers as far as unfunded mandates that have come along with us during those years. We have, transportation, insurance, supervisory staff. So we have actually, while we appreciate everything to move forward, we do need to be able to have a sustainable rate. During COVID, it has been extremely hard to keep staff, as you can imagine. With everyone, there's been a problem with keeping staff in businesses across the nation. But that being said, once we do not have these federal funds, we are going to still be in big jeopardy. Real quick, I do want to tell you a little bit about what all we do. Northwest State School was a big part of the community that I'm from, Northwest Louisiana, and we had actually 2 young men that were in Northwest State School. One gentleman of the 2 brothers, due to being unattended, actually had choked himself. He put toilet paper in his mouth. He was unattended. The other brother got out onto these now waiver services and did extremely well until he passed. Our success is huge with these individuals. These services are gravely imperative for us to have. It makes more sense for money to go into these services. On House Bill 645, it was great that we had a win for our NOW services, but unfortunately, the elderly were left out of that passing. So we still have some things that we want to work on, and along with LDH, and of course with the support from you all, we want to be able to get to a point to where we are safe and not continually every year coming to see you to talk about these same issues. And most of you probably recognize my face. I've been here so many times. So it will be a win when I don't have to come visit you quite as much. But along this way, we're getting more and more mandates on us, Representative Edmond. So even though those wins are great, while we're having more medical, more transportation, more things that LDH is demanding of us, we need to look at the overall big picture. So that's why we are here once again, is we need help to move forward to 2025. So that's, we are moving forward, but we need something that will say, hey, this is sustainable, here we are, and we're not going to be juggling around in another year. It creates a great hardship on the overall service.
Gotcha.
So I'm going to pass it over
Okay.
if you don't have any questions.
No, ma'am, board's clear.
Okay, I'm going to give it to Jackie.
Good morning again, and my name is Jackie Blaney. I'm the Director of Independent Living here in Baton Rouge and the coordinator of the Louisiana Supported Living Network. We're a network of in-home support providers with members from Shreveport to New Orleans. In the interest of time, I have prepared an information sheet which you all have for your review. I would like to highlight a few areas that might not be self-explanatory on the sheet. I'm going to focus today on LDH's Office of Aging and Adult Services in-home supports to persons experiencing adult onset disabilities, including older adults. Sometimes I think, we live and breathe in these services and we know it so well that I think from time to take an opportunity to share, exactly what the services are and which department, and that might be helpful to you guys. So I want to take a little minute to do that. We are licensed by the Department of Health to provide support to maintain optimum health, safety, and well-being. That's what our charge is, and that's our mission. You'll find this in the CMS and LDH regulatory documents. This refers to increasing and maintaining overall quality of life, including supporting the persons with their living environment, with meaningful relationships, with their spirituality, security, engagement in activities of their interest. As you can tell, home and community-based services strives to provide a holistic approach that is best practice, and research has shown increases physical and mental health, as well as lowering cardiovascular disease, stroke, and other health concerns. In addition to providing support to avoid unnecessary hospital and ER visits. The implementation of these supports requires trained and competent internal support managers that support participants with information, advice, and assistance in many areas of life, from how to handle difficult personal situations to how to handle declared emergencies. This management level includes many of the unsung heroes of this ongoing COVID pandemic. And of course, trained and competent direct support staff are essential to these quality outcomes. We are all aware of the increase in cost of living that provider rates have not kept up with this cost. Our members are dedicated and committed to serving people. However, we cannot do it alone. We need your help, as been stated, to develop and maintain equitable and sustainable system that provides reliable and adequate in-home support provider rates. We need your continued support to ensure funding that is rooted in best practice, saves lives, and is what our citizens want and deserve. Thank you very much.
Yes, ma'am. Thank you. The board is clear. It looks like we have at least two more people that would like to speak. Catherine Dwyer and Andrew. If you all would step aside and let them take a seat. Thank you. Ms. Dwyer, if you'd like to start.
Good morning. Thank you, Chairman Henry, and thank you, committee. I appreciate you letting me speak. I mostly came to listen, but as Carolyn and the other ladies from the Provider Association were speaking, I felt it was necessary for me to report from my perspective. First and foremost, I'm the mother of my daughter, Jennifer, who is 45 years old, born with multiple disabilities. She tends to be amusing. But I'm also chair of OCG's State Advisory Committee, and I'm on the Jefferson Parish Regional Advisory Committee for Developmental Disabilities. I worked for the Human Development Center for 25 years. I'm retired from there, which is the state's developmental center in disabilities, and I worked for Families Helping Families and the Autism Society of Greater New Orleans, so I have vast experience from both a parent and providing support to families. I can say personally that I am concerned about what is going to happen when federal funds do run out. I'm very grateful for the wage rate y'all provided for support coordinators, support workers, early steps. I'm very grateful for the funds, even for the comprehensive dental that I helped advocate for. But what I'm concerned about is who's going to help me take care of Jen as I get older. I just had my 68th birthday, and I'm starting to have some aging issues. And right now, Jen's day hab is closed. It's been closed since the pandemic. They've been trying to open. They were ready to open, and then Ida came. They had significant damage. They finally got all that damage repaired, and now they can't find enough workers. They're saying they're barely finding enough workers for their group homes. We also can't find support with the home and community-based waiver for the in-home care. Right now, a supervisor is coming to help just to bathe with Jen because I had some serious back issues that I needed help with, but that's the most that can be provided. So it really concerns me as we're aging. And when I look at it, even with the rate increase, I wonder, if we need to do more, and I'm pretty sure we do. The national average is $14 an hour for direct support workers. During the pandemic, we lost thousands of workers dying from COVID. We also lost quite a few who retired. It's the baby boomer generation, so a lot of people are retiring now. And then now with businesses holding on to that virtual option to work and their higher pay, the jobs are even more competitive than they were in the past. So I'm hoping that we can just make sure we protect what we have for sure in the future. I loved when one year you put in HB1 in the preamble, or I think that's what it's called, I'm not sure, that cuts would not be made to developmental disability services when there is a tight budget year. I hope you do the same also for the elderly. These are our most vulnerable citizens. When you start cutting those programs, that's when you start seeing people getting less quality care or no care at all and puts their lives at risk. And that's all I really have to say. I just really support and appreciate everything you've done for us, and I'm happy to help in any way I can with information.
Okay, thank you, ma'am. The board is clear. Andrew?
Thank you. Andrew Mull, AARP Louisiana. Thank you. I won't repeat comments that have already been shared, but first, I really do want to echo the thanks that's already been given to the Medicaid Oversight Committee for raising the visibility of this issue last year. We find that it's an incredibly crucial issue to providing care. And I'd also like to thank the previous speakers for really spotlighting the discrepancy that existed between the aging providers and the disability providers. Aging providers are providing the same level of care as the developmental disability provider community and deserve the same rate of payment. The woman referenced House Bill 645 that was brought forward to the legislature last year. It was introduced by Speaker Pro Tem McGee and had several of you on it as sponsors. This bill would have created a trust fund called the Community Options Trust Fund, which would have really helped seniors who live in their own homes and help more receive care in their communities. And it was really modeled after the Now Waiver Opportunity Fund that was created in 2007. And simply what that fund does is it takes a small percentage of excess revenue in a budget year and puts it into a fund that can be used for increasing provider rates and more slots for services. The fund, it depends year to year how much the fund might draw. Some years it won't be anything, but some years it might just be a little bit of money that can go towards providing some additional funds for care. So we're going to be bringing that bill again in 2023, and we hope that members of this committee will support it. And if passed, it'll help more seniors provide more services and hopefully create a more balanced provider rate structure. So I'm happy to answer any questions.
One question, Representative Bacala.
Thank you, Mr. Chair. Less a question. I just think it's, as we go forward, kind of look back on how we got where we are. And quite frankly, you know, we're legislators. We're not the smartest people in the world, but we listen pretty well. And the first round of increases came about, and you mentioned this, Andrew, you know, meetings like this with this group and with appropriations and with personal phone calls. We became aware of the problem with the developmentally disabled population and the issues with the quality of care, you know, the quality of the person giving the care, their lack of knowledge often, the high turnover rates, a lack of resources, a lack of, I mean, just people were begging for services, and often the service they received was substandard. We didn't know that till somebody told us that. And once we delved into it as a committee, so I credit everybody here, once we really looked into it, we agreed, and that was the developmental disabilities increase, the rate increase, because we recognized the problem. Same thing happened last year with elderly service. We don't know there's a problem till somebody tells us there's a problem. So I think it's important that, you know, the legislature has meetings that are open to the public so that we can learn from you guys about where the shortfalls are, so that we can try to address those. So I just wanted to look back on that history and let you know how we got here. And your successes in the future are going to largely depend on the information that you're able to share and the compelling stories that you're able to tell at committees like this. And you have to make a case, all right, for the need, because the budget is all about competing interest. Everybody wants the dollars, and you know they're finite. There's only so many dollars, and you try to spread them around where they most need to go. So not a question, just a comment. We got that increase because you proved you needed it, and now you're going to need to go back, I think, and continue to push the buttons. And make sure that you're not forgotten. So that's it. Thank you, Mr. Chairman.
Gotcha. Okay, the board is clear. Thank you, Andrew. Thank you all for coming. This is kind of this is the first time that someone's actually been proactive in saying in the future, not like next year, but looking forward, saying in 2024, 2025, we expect shortfalls, so that when we're preparing the budget, not only this year, but moving forward, we can ideally anticipate and start building towards it now. So it's very helpful. So thank you all very much for coming.